Dr. Vivrette is a child clinical psychologist and assistant professor at the University of Maryland School of Medicine. You want to say her next name? And she helps to lead the violence prevention working group of our coalition. She's a project director for the Family Informed Trauma Treatment Center at the School of Medicine, a Category 2 center within the National Child Traumatic Stress Network. Her area of expertise is in early childhood mental health trauma and parent-child relationships, and she helped to organize this briefing with me, Elena.
Thank you, Denny. So I'm going to be a brief to start, and really what I'm going to do is help frame the briefing today and highlight some things that I really want us all to think about together as we're hearing the different presenters, and then have an opportunity for discussion. Because I think we all recognize, just by being here, the importance of violence prevention and that it needs to be addressed for youth. We are going to hear from several experts today about what we know about violence and how to prevent it using established evidence-based programs. And some of the things that I'd like to highlight first that Denny already mentioned is the impact of trauma. So we now know that trauma does not very often occur in isolation. Where there is one trauma, there is likely to be multiple traumas. And the majority of these traumas begin very early on in childhood and they accumulate over time. So we must focus on preventing those early traumas, and many of those occur within the family context before a child even enters the school system. So starting at school age can potentially be too late to intervene in that very early exposure period. And in addition, many children grow up with parents who are still managing their own childhood trauma histories that have also not been addressed. And that affects their ability to nurture and parent their children. So at UMB, we recently did a study, a community-based study with mothers of young children and pregnant women, and asked about their childhood trauma histories. And we found that 2/3 of those women had experienced 4 or more childhood traumas. And we know from the adverse childhood experiences studies that they're at significant risk for a number of psychosocial and physical health issues, as well as premature death and violence perpetration for their children. The second point that I'd like to think about is really thinking ecologically. So neighborhoods matter for kids, and relationships between social, political, and family factors are really complex and are going to demand innovative solutions from prevention science, but that cannot be developed or sustained without partnership with the community. The community is the expert in their own experiences. We are not the experts in the community's experience, but we can partner with communities to develop strategies that can help prevent violence from going forward. Which brings me to my final and most important point, and that's that relationships matter. It's not just about the content of our interventions, but who is delivering the intervention. So in our survey with moms in Baltimore, the reason we were so successful is because we used surveyors who were from the city, who knew the city well, who were trauma informed in their training, and who were well skilled at developing relationships and rapport quickly with women. And so women felt comfortable opening up and sharing their experiences. And I think that's why we have the data that we do, and that we're able to represent the experiences more accurately of that population. So as we go forward, even with the best intentions, families will continue to disengage in our programs if we aren't thinking about relationships and how to build that into our programming from the beginning and throughout program development. So the good news is that we know a great deal about violence and how it develops and how to prevent it, and we're going to hear a lot about that today. And as Denny mentioned, I'm the head of the Violence Prevention Working Group in the NPSC. If you have any interest in partnering with us or joining the NPSC or potentially the working group, please come see me after or contact myself or Denny or Neil, and we'll get in touch and share more information with you. We're represented by experts from across the country, from universities, organizations, policymakers. We're all very passionate about this issue and developing proposals that are going to affect real change. So please get in contact with us if you're interested.
Thank you.
Yep.